Right, welcome to Chat with the GP. I'm Dr. William Bird, and I'm really pleased to be able to introduce again Dr. Bernie Choi, my colleague who I've worked with for many years now and absolutely love working with him. Always has a good view on things when I'm going around the corner to say, Bernie, I don't understand about this patient, can you help me? And he always comes up with some wonderful advice. So we're really pleased to have him. We're going to be talking about back pain. Back pain, as we all know, is unbelievably common, but also a real scourge to workplaces as well as our daily life as well. And particularly if you're trying to keep fit and be active, you've got young children, you've got other things to do, it can be hugely debilitating. So absolutely great to talk to Bernie. Bernie, can you just guide us through what back pain is, how we should be able to deal with it, and what we should be looking out for if there's some concerns?
Sure. Thank you, William. Okay, so back pain is actually a really common illness. In fact, alongside depression and stress, it's the most common cause of certifications which doctors give to people being off sick. So it's really important to try to avoid it if possible. Okay, so what causes back pain? Well, the most common cause of back pain is actually through poor posture and or through lifting in a bad way.
Sit up.
What would be the... Sorry, go on, carry on.
I'm sitting up now to get my posture right as I'm slumping down in my chair. So this is probably a bit of a wake-up call for me as well.
Absolutely. And we all do this. And we'll talk a little bit more about posture in just a moment. So symptoms of back pain. Well, in terms of mechanical back pain, what we mean by that is when your muscles and your joints go into, they manifest themselves as pain and or spasm. And what we mean by spasm is that when you move your muscles or your joints, it's like that, ouch, oh gosh, actually if I keep still, I'm happy, but if I move it, oh, it causes me more spasm. And that's through your muscles and joints tightening up. Also, as a result of mechanical back pain, you can get numbness and or weakness going down either your arm or your legs. And if that's the case, that implies that the spasm is not insignificant. So, how do you differentiate mechanical simple back pain of your muscles and your joints from what we call red flag symptoms, which are more worrying symptoms, more worrying problems? Okay, so in medicine, we talk about red flags, meaning symptoms where, as a doctor, we sit up and think, hang on a sec, I think there's something potentially quite serious happening. And what we talk about is saddle anesthesia. So if you sit on a bicycle or a horse, between your legs, can you feel yourself? And if you've got numbness there, then that's very serious, and as a doctor we'd want to know about that. And or incontinence either of urine or bowels. So in other words, you're sitting there not doing anything and you literally wet yourself, or you're incontinent of feces. Again, you ought to see your doctor about that. Now, this is subtly different from urine incontinence when you sneeze or cough or laugh, which happens particularly with older ladies when they've had children. So that's not what I'm on about. I'm just on about you're sitting there doing nothing and something is happening down below in terms of urine and bowels, and or you feel yourself between your legs when you sit on a bicycle saddle and you can't feel yourself. Please contact your GP as soon as possible, or if you can't get through to them, it would be worthwhile potentially going down to casualty, because that's what's called a neurosurgical emergency. And it's a reversible cause of numbness and weakness in your legs and incontinence, but if it's not dealt with within 12, 24 hours, it could have long-term damage to your body, but it's a reversible cause, which is why it's important to seek help as soon as possible.
So, Bernie, you say that, and obviously that's quite alarming, bit worrying. Suddenly, an emergency, you've got to go to get neurosurgeons. But in context of back pain generally, how common is it? And is that something that's you see frequently, or is that a bit of a rarity?
Very, very rare. I mean, I probably see one case a year, if that. And normally there's a history, they're predisposed, they've had recurrent back pains, maybe some surgery before.
Okay.
It very seldom occurs out of the blue. But obviously if you had a bad fall, bad accident, that could be the case. And if you've got those symptoms, you must seek help immediately.
Okay, I hope that's a bit reassuring for people who are thinking, help, that's going to happen. But you've mentioned it, you've told them what to do. And it's kind of when you're wiping yourself, isn't it? You just can't feel it very well. You just
absolutely
that funny kind of, or sometimes that tingling feeling is not quite there. But no, thanks for that. So I think that, and as a doctor, I think we're always worried that we're going to miss that. So, a really important thing to put across.
Sure. And just something to clarify, you mentioned tingling. Tingling's kind of okay because there's still a bit of a sensation. But if it's actually just numb, it's anaesthetized, then you must seek help because that's clearly not right.
Great.
So we'll move on to what we call non-mechanical causes of back pain. So non-musculoskeletal, not related to your muscles and your joints causing back pain. Well, if you develop symptoms of a fever or a rash, or if you get multiple other joint involvements, I would ask the question, is this really mechanical back pain or is there something else going on? So coming on to things like a fever or rash, things like shingles that can cause it, and then with regards to other joint involvement, if you don't just have your back and neck involved, but let's say, for example, your hands, your ankles, your knees, your hips, and you haven't really been doing anything to upset those things, then I'd start thinking about other causes of that. And there's this group of illnesses, what we call autoimmune diseases. So autoimmune means that your body has antibodies to help fight off infections. And that's great because we've got a viral or a bacterial infection. Your antibodies, your white cells antibodies, go to attack those baddies. Now, unfortunately, your body can actually start to attack itself. And if it starts to attack its joints, that's often called rheumatoid arthritis. It can also affect your gut, and hence you can get pain and bloody diarrhea. That's called Crohn's or ulcerative colitis. And these autoimmune diseases can affect other parts of your body. So if you do have other things happening, again, it's very important to have a chat with your GP about this. One thing I would say, however, it's quite important to differentiate this from what we'd call, well, not just mechanical back pain, but also osteoarthritis. So rheumatoid arthritis, because it's an inflammatory arthropathy, classically, people wake up in the morning with this pain after not doing anything, just sleeping. And then as the day wears on, the pain actually improves. As opposed to mechanical back pain or osteoarthritis, you've had a good night's sleep, you wake up in the morning not having lifted, done stuff to your body, so it's actually relatively okay, maybe a little bit stiff, but not really in much pain. Then as you get on with the daily activities, walking around, lifting, carrying things, the pain starts to increase. That would be your classic back pain and classic what we call osteoarthritis, which is kind of wear and tear of your joints, which happens with older age, and it's even affected me a little bit in my knees. So it's very common, but not something you need to be quite so alarmed about.
And again, on that, the rheumatoid, from the back pains you see, again, how many times would you have found that it was autoimmune, it was associated with some other aspect of the immune system compared to the mechanical? Is it still quite,
Sure.
Is it still rare?
Autoimmune diseases are relatively rarer. I think if there's a strong family history, so parents, uncles, aunts who've had rheumatoid arthritis or Crohn's, ulcerative colitis, I think you have to increase your index of suspicion.
Okay.
And also there's an age differentiation. So classically with these autoimmune diseases, it peaks either as a kind of teenager, early 20s, 30s, and there's another little increase in the 50s and 60s. So that would be with the autoimmune diseases. So it's relatively rare.
Brilliant.
So should we move on to management?
Yeah.
So in terms of management, as they often say, prevention is better than cure. So prevention, first of all, good posture and good lifting. As I'm talking to you folk, I'm aware that actually my neck is already flexed forward. If I turn around sideways, can you see how I'm not changing my position, but my neck is actually flexed forward. There's a curvature of my neck and spine. And ideally, what I want to do is, can you see there? What I want to do is kind of lengthen my spine, and the physiotherapist talk about, imagine you've got an invisible piece of string in the crown of your head, and you want to pull it up, right, okay? So it's not like in the army, whereby you're standing tall like a sergeant major, and your eyes are looking upwards like that. That's no good. Nobody looks like that. But my eyes should actually be looking horizontal. That should be how it is. But also kind of relax your shoulders and it should all be relaxed, but actually like that, rather than face forward, hunch forward, which is not good for us. So that's a really simple heads up. And then, as I'm sure you're aware, you folk who use IT, we all have health and safety at work. So make sure the height of your chair is good. Everything should be at 90 degrees, feet flat on the floor, your knees bent at 90 degrees, and then your shoulders and your arms should be resting on the table, all at 90 degrees. So too high will cause shoulder pain, too low will actually cause low back pain and actually causing us to sit forward. And then little hacks like making sure your monitor is at 15 degrees to the horizontal, and maybe get a laptop riser if you're using laptops, or use a separate keyboard so that way you get good posture, because if you're like that, then that's really bad. The other thing which I always say to my patients who have back pain, neck pain, I say, do you use your phone in bed? And they say, yes. Okay. And I say to them, well, actually, if you use your phone in bed, this is really bad news, because the chances are you'll be sitting up, hunched over your phone, and this is really bad for you. So, in bed, lie flat, okay? If you need to use your phone, actually get out of bed and sit upright, because that's very important. Okay. Oh, and finally, with regards to lifting, as I'm sure you're aware, we should always we should lift with our back straight, okay, and lift with our legs. So a bit like a weightlifter. You never see a weightlifter picking up the weights bending forward, okay, because if our spine is bent, it's very weak. We should be upright and lifting from the legs upwards, okay. Okay, so we have our back pain. What can we do in terms of pain relief?